Hi, this is Dr. Surimi. I'm a neurologist and a movement disorder specialist working at Hoek Hospital. So today I'm going to talk about the role of exercise in Parkinson's disease. So this is the very hot topic, especially important for Parkinson patients to understand the importance of the physical activity during the course of the disease. So after we finish this talk, I believe everybody should understand the role of exercise and in modifying Parkinson's disease progression. So we all know that there are, during the physical activity, there are a lot of changes happen inside the brain. And this slide is basically summarize the importance of the changes or chemical changes that occur in the brain and ultimately cause that what we call improve the brain health. And with just a simple and regular physical activity, we will have significant changes in the brain that I will go back on this slide after discuss a little bit about the details of all these sort of changes in the brain. So we should realize that in Parkinson, we do have some area of the brain that is causing some changes. On the left side, this is the section of the brain that shows the area that is involved in the Parkinson is called basal ganglia and substantia nigra. And on the right side, it shows that those area has a very big connection with other parts of the brain, including the frontal and temporal. It's not just being inside of the brain, but we know all those inside nucleus inside the brain has a lot of connection with the other side, therefore can help us to have a very smooth movement. Therefore, in the lower part, it shows that the physical activity and exercise has a direct impact on basal ganglia, the area that significantly affected in Parkinson. And basically increase the neurotransmitter and tropic factor inside the brain, including dopamine. And subsequently, by increasing those neurotransmitters and also decrease some of the kind of neurotransmitter that are not needed to be increased, like a glutamate, ultimately increase the synaptic connections between the neurons and increase the mitochondrial the function. So, but the problems that we have in Parkinson because of the decrease of the dopamine, we do not have such a great connections and all those neurotransmitters inside the brain. So, therefore, one of the role of the exercise to regulate this function inside the brain and ultimately improve the mobility and locomotor in Parkinson's disease. Here are some of the neurotropic factors that that are important to know, and all those factors has a different or ultimately the cumulative effect on the brain, including cognitive and learning, include like the improvement of the vasculature and blood flow to the brain, and ultimately improve the movement. That's what we call neurotropic factors. So ultimately, when we do have those factors, those ultimately decrease the oxidative stress, and reduction of the oxidative stress improve the mitochondrial function, and basically mitochondrial function is improve the energy inside the brain and improve the movement and brain health. So it's been shown that the effect of the exercise is not just limited to neurotropic factor. It also increases the excitability of the cortex, especially corticomotor area, and subsequently improve the gait. Change the gray matter volume. It means improvement of the blood flow to the gray matter, and as we previously discussed, increase the neurotropic and ultimately decrease the rigidity and improvement of the movement. So now back to the previous slide, it shows that the exercise, by improvement of the neurotransmitters and improvement of synaptic connections, and basically improve this circuit inside the brain, that between the brain, the basal ganglia and other side of the brain, and ultimately increase the sort of locomotions, improve cognitions, and make the patients walk easier and better. So this is the first study that I talked today is about they basically recruit 100 Parkinson patients. And those patients was assessed in the different way, not only the motor function, but assessed the depression, cognition, and fatigue. And they put those patients in the different type of exercise program, including the yoga versus aerobic exercise. And the conclusion was, even like after 3 months, even just a simple yoga and balance training can have a big impact of quality of life, emotional state, attention, and well-being, and overall mobility, the mobility feeling. And both intervention had a positive effect on coordination and dexterity. And this ultimately translates in improvement of the motor plasticity. So let's define what is exercise and what is physical activity. The physical activity is increase any sort of movements that increase the energy expenditure above the baseline level. So exercise is a subcategory of physical activity, and it's a planned, structured, repetitive, and intentional movement with the goal of improving of the health and well-being. So aerobic exercise is movement of the rhythmic manner of a group of muscles that in a sustained period of time. The more important in the aerobic exercise is the intensity, frequency, and the duration. How hard the person exercise, how often, and how long involved in this type of activity. So in aerobic exercise include brisk walking, running, cycling, and swimming. This is one of the first studies that was done in to see whether there is any aerobic, whether if aerobic exercises has any impact on Parkinson's disease. So they basically recruited about 120 patients with a mild to moderate Parkinson, and randomly put them in the 3 different categories. One was in a treadmill and asked them to work on a treadmill for 30 minutes with heart rate increase up to 65 to 80% from baseline. The second group was only like balance, flexibility, and stretching. And the third group was just a control group. So they analyzed all the data in the 3 different timing, which was 4 months, 10 months, and 16 months. This is actually a very long study in this matter. And it showed that there is a significant difference between the aerobic and the control group in the means of there is an improvement of the patient's walking ability and oxygen consumption with after 4 months and 10 months, and this continued for 16 months. And they also noticed that there is a difference between the group that are involved in the aerobic compared to the group that just work on the balance and stretching, and those were actually meaningful. Unfortunately, in this study, did not check the clear like motor score of the UPDRS that we usually is a value of there is a scaling value for Parkinson. This is the second study that I believe they recruited about 50 or 60 patients, but however the study was designed in the high intensity group, low intensity group, and just a stretching group. So this particular study is mainly look at the walking ability and 6-minute walk, and also cardiovascular. At the end of this study, it shows that the group, the patient in the group of the high intensity and low intensity physical activity showed better values compared to the group that only was stretching. This is the third study that look at the other 2 studies that we discussed. The Parkinson patients was allowed to walk on a treadmill, but this study was actually a study that the measurement was done on overground walking. This is about 50 patients in a mild stage of Parkinson, and they asked them to walk 3 times a week for 45 minutes, and it was in community setting. The heart rate was monitored 70% above the maximum, and the outcome of this study, it was very interesting that shows the group that in this study is basically the study was pre and post, in the means of all those 50 patients was analyzed at the prior to the exercise program and after 3 months of exercise program. And the values that you see in that graph is shows significant improvement after only 3 months of exercising, including the walking, and in this study also look at the motor UPDRS that also shows improvement, and fatigue and some other non-motor symptoms of the Parkinson. So the other studies that I found was about the recruited 17 patients in Parkinson disease, and they look at the walking and cognition. The patients were in moderate stage of Parkinson, and randomly assigned to treadmill versus just social interaction. After this study was a 12-session study, 3 weeks, 3 times per week for 4 weeks, and every time was a 45 minutes. At the end of the study shows that the group that was involved in aerobic exercises showed significant improvement of executive function, attention, memory, and obviously in mobility compared to the patients that was just having interaction and not much involved in the physical activity. This is directly support that even patients in the moderate stage of the Parkinson disease still have a benefit of the physical activity and exercise. So now the question is, does physical activity and exercise has a modifying effect on progression of the Parkinson? So, because obviously based on the previous study showed that yes, there are improvements of the motor functions, cognitive, and other functionality in the Parkinson, but does those really translate to a slowing the disease? This is a first trial of that they call a Sparks trial, and it was about 130 patients at the earliest stage of Parkinson. De novo, it means that the patient was not started on any treatment. And they basically put these patients on a control group and two other groups, which was a moderate intensity exercise 4 days per week, 60 to 65% of heart rate maximum, and the high intensity exercise 4 days per week, 80 to 85% heart rate. Then they analyzed the patients after 6 months. The problem in this study was after 6 months, it was very hard to keep those exercise group in a certain heart rate. And after that, they basically mixed those group and later analyzed after 12 months. The study showed, and in this study, so the goal was to, the outcome was check the motor aspect of the UPDRS. And after 6 months, it showed that the patient in the group of high intensity has about 3.2 difference compared to the control group. We are talking about the patients that has not been started on treatment. The treatment only was exercise. So there was not much changes, as you see, between the low intensity and the control, maybe about 1.2, but there is a significant difference between the control group and high intensity. This means that the exercise clearly slowed the progression of the Parkinson. And based on this value, even exercise alone can slow down the progression of the disease to the point that whether need a medication or increasing the medication or other adjustment. So, but we just talk about walking, but what about other type of aerobic exercise like cycling? So this is a study that is a Parkin shape looking at the cycling aspect. And there is 130 patients in the earliest stage of Parkinson, H and Y, the stage 1 and 2. And they put the patients on the trial of cycling, and they allow to do those stationary bike under supervisions. And after 6 months, they compare to the control group that they were not involved in the exercises. The importance about this test is the outcome was mainly looking at the motor aspect of the UPDRS on off state. It means that the patients feel very slow and off medications during the scoring. So the outcome was clearly 4.2 difference, which shows even cycling has a big effect of modifying the progression of the Parkinson. And again, those patients are the patients that were in the earliest stage of the disease. So a SPARK trial was looking at the treadmill, and Parkinson was looking at the cycling, and it shows that any type of aerobic exercise has a potential effect on the Parkinson cases. So, well, they also look at other aspects, not just the motor aspect of they look at the quality of the walking, they look at how fast they walk, and even the effect of the cycling, it shows there is a significant improvement. So in this study, compared to the control group, they noticed that the number of falls, the speed in the 6-minute walk, and also improved compared to the control group that was only involved in the balance training or might be no exercise. I just put this slide here. We are not talking about this because this is a phase 3 of the SPARK trial, which is a very kind of expanded study, and they recruited, I believe, about 130 patients, 370 patients, and they followed those patients for 2 years. And in this study, the graph on the right, it shows that not only the motor aspect of the UPDRS has declined, it means the score, it's lower in the terms of the patients that does not progress faster after 2 years. They also, those patients did not require higher dose of medication, the dopamine medication. So improvement of the motor function and decrease the medication need for those patients that they were involved in this trial. So this is another study that used 17 Parkinson patients and look at the functional MRI. Functional MRI look at the metabolism of the brain, and they analyze the substantia nigra, the area that there is a decrease in dopamine and affected and significantly affected by Parkinson patients. So they put those 17 individuals on 5 restraint training exercise, and after a certain time, they check the fMRI, and shows that on the right and the left, both increase dopamine production in the substantia nigra. As you look at the right bar is higher than the left. The left is prior, and the right is the one after the exercise in a certain timing. So we mainly look at the aerobic exercise, but we also know that the resistant exercise are beneficial. And it's been shown that both forms of exercise are beneficial in early and middle stage of the disease, in the terms of decrease the progression, decrease the need for the medication, and improvement of the balance, walking, and decreased falls. So there was nothing from like a brisk walking, cycling, or treadmill walking shows superior compared to the other type of aerobic exercise. And moderate or high intensity aerobic exercise are beneficial, but still even low intensity it can be beneficial. So, but the studies that so far show that moderate and high intensity has a disease modification effect in earliest stage of Parkinson. And resistant training must be progressive in nature to optimize the benefit, and exercise must be carried out regularly over time to sustain the benefit. So the type of the exercise that we recommend to our patients are, in regards to aerobic exercise, is a brisk walking, treadmill, coordinated walking and cycling, and task-specific training like dual tasking, queuing, and strength training such as gentle weight and machine. And as far as the patient cannot participate in the aerobic exercise, we still encourage them for balance training, yoga, and dancing. Actually, it was one of the most coordinated and fun exercise in the Parkinson. And ultimately, if they cannot involve in any of those physical activity, at least stretching and increase the range of motion. So in summary, exercise in Parkinson disease, the majority of the studies that we discuss, actually there are many other studies that it was beyond our talk, shows that there is the direct the disease modification and slowing down the disease. The studies even done in the animal model showed that the disease modifying effect of the aerobic exercise, and also any type of the physical activity such as aerobic exercises is very important, not only in the motor aspect but non-motor aspect of Parkinson, such as cognition, depression, fatigue, mood issues, that very helpful. And the way that we arrange this exercise for our patient is we place a referral to physical therapy, and one of the importance is we renew the physical therapy every few months in order to encourage the patients and provide them with the continuity and encourage them to follow up their recommendations and do the exercise regularly. Even 6 hours per week, which is the minimum amount that we usually recommend, is very beneficial for patients with Parkinson. And again, I just talked about this in the previous slide. The recommendation is 3 times a week, at least 30 to 40 minutes, at minimum 5 to 10 minutes, but definitely should be some warm-up, and try to increase the heart rate to 70 to 85%. But at the minimum amount of the Parkinson exercise that is recommended is 6 hours per week, but you can always adjust it to the 3 times a week, 2 hours minimum. Both treadmill and cycling are beneficial, and other form of the aerobic exercise and resistant exercise also can be included in your training. The take-home message is all the studies clearly shows that everybody in Parkinson should exercise. The patient will suffer from delaying starting their exercise program, mounting evidence that the exercise is good and sooner is better than later. And doesn't matter what they do, just get up and get out and participate in physical activity. So, and this slide showed that sad neurons can easily become happy neurons after participating in exercise. So one of the questions that brought up was whether exercise can replace medication. So we know that in Parkinson's disease, there is a lack of dopamine in the brain, and ultimately, all the patients require dopamine replacement treatment. As we went through all this slide, it shows that in the earliest stage of the disease, you can always delay the treatment by involving in the certain exercise. But ultimately, patients require to replace the dopamine, either, and the treatment for them is the dopamine replacement by medications. So yes, you can basically delay the treatment by exercise, and this especially in the earliest stage and moderate stage, but medication ultimately needed. The other thing is, if you continue participate in an exercise program, you can potentially decrease the need to increasing your medication. So you can stay on the low dose medication to improve your flexibility. And I have patients that come to me in an earlier stage, and we haven't even increased the medication for 2-3 years. So because they are basically very motivated, exercising regularly, but ultimately they require some sort of medical treatment. So the other question is whether exercise can worsen Parkinson, like heavy lifting. So we don't usually encourage patients to involve in a risky type of exercise, because we know that the Parkinson decrease the coordinations, and if you do some exercise like rock climbing or some sort of activities that require full attention and coordination, so they may increase the risk of injury. We usually recommend like a light to moderate weight exercise, not to the point of heavy lifting. And but those usually recommended by the type of the physical activity, usually recommended by a physical therapist. And obviously, once you exercise regularly, you may need to increase your type of activities, like you do like a 10 minutes treadmill, now you can do 15 minutes treadmill. Although the majority of the studies that we went through was just a regular treadmill or cycling, but we know that the resistant training like weighting also improve the quality and coordinations and well-being of the Parkinson. But whether this is the very kind of heavy lifting is potentially helpful, I doubt, but they may increase the risk of injury. So can exercise prevent Parkinson? Definitely. Actually, there was a 3 slide that I show you that has a disease modifying effect. Actually, the majority, we should realize that the medications that currently we use for Parkinson, we are mainly treating the symptom. Unfortunately, there is no medication to reverse or slow down the disease. The only treatment that can slow the disease progression is exercise. This is well known, and those studies that I show you, one of them was actually done like 15 years ago. So we all know that the exercise has a very big effect on slowing the disease. There was another study that I did not include it, and they look at the group of the people and follow for many years, and then they look at those group that whether ultimately some of them develop Parkinson. It's very hard to have such a study because we don't have a marker for Parkinson. Therefore, we don't know which individual ultimately develop Parkinson or not. But in that particular study, show that the people who are involved in the exercise has a decreased chance of developing Parkinson compared to the people who do not do much physical activity or exercises. So the things that are unfortunately lacking in the field of Parkinson is, one is we do not have or found the medications that reverse or slow the disease progression, and we do not have any like a blood marker or any sort of radiographic marker to show that whether certain individual has higher risk of Parkinson, developing Parkinson in their life or not. But hopefully in near future we can have those. Any other questions? Thank you, and if there is any questions, I'm one of the doctor at Hoek Hospital, and you can always reach me or call my office, and I'm happy to discuss either this study or other studies in further. Thank you.